Many doctors have difficulty explaining to their patients why a genetic diagnosis is important in addition to a descriptive diagnosis like developmental delay or autism spectrum disorder. I often explain to families the fact that we're looking for more than just a descriptor for what's happening with the child. We want to know why that descriptor is present. We want to know why that child has developmental delay or autism. It's almost as if a patient is asking, "What's wrong with my car?" Your car is broken down. That's not a detailed enough answer. A mechanic isn't going to know how to fix a broken down car. They need to do a diagnosis on that car. Is the tank out of gas? Are the tires not working? Do we need a new engine? There can be a variety of reasons why something is not working properly. And until we know that specific reason, we don't know how to fix that car, or in this case, treat that patient. That's one analogy that has helped families understand the importance of having a specific genetic etiology to their child's developmental delay or autism spectrum disorder. Let's talk through a real-life example. There may be two children, similar in age, who both have low muscle tone, speech and language difficulties, and developmental delay. Maybe they're not walking at the age when their parents expect them to walk, when their same-aged peers walk. If we performed CMA for both of those children, it would not be uncommon to find that one of those children has DiGeorge syndrome, which is also called 22q11.2 deletion syndrome. It would also not be uncommon for a child with those descriptors to have a deletion that corresponds to Angelman syndrome. These are both conditions that are diagnosed by the CMA but have vastly different prognosis and medical comorbidities for the child. In the case of 22q deletion syndrome, that child should be screened for certain heart defects. Their palate may have abnormalities that are causing the speech and language issues, and that individual, as well as his or her parents, could be at risk for certain psychiatric illnesses if they have the deletion as well. In contrast, the individual with Angelman syndrome has a very high risk for seizures, and that child could very much benefit from an evaluation with a neurologist to get a baseline understanding of what's happening with the brain. And Angelman syndrome is most often de novo in a patient. That means it's brand new, not carried by one of the parents. So two children can present in very similar ways. Both can have a general diagnosis of delay or autism, but both can have very different conditions, and those kids need to be treated differently. Not to mention, the families can find out the facts about their child and become part of that genetic community. There are support groups for both of these conditions, and it really benefits parents and other family members to know what's happening with their child, to have an understanding of what happened. It really helps these families forgive themselves. They might be harboring some blame, and genetic testing can really begin to help families cope with some of these issues.